Where is your station?
Okay, I'm
All right. So
ready.
if you've read and understood considering it communication skills station, please begin.
Good afternoon. I am Dr. Ahmed Awan, one of the surgical doctor. Nice to meet you, Mr. John. Today I have been asked to talk to you regarding your warfarin bills. You have some concern about warfarin bills. Can I
Yeah,
know what's
doctor.
your concern? Yeah.
Yeah, my doctor told me not to stop it because it can threaten my life.
Oh, I understand your apprehension. Uh, but let me explain to you what's warfarin and why you are taking this warfarin. Warfarin is a blood thinning medication that prevents a clot inside your blood vessels. And you take warfarin because you did a valve replacement 3 years ago. Am I right?
Yeah, doctor.
For that, it protects you from the floating around this artificial valve. Uh, the problem is you are we are planning to do a surgery for you in the your groin for your hernia. The problem is the warfarin have a risk for bleeding if you take it and we did this surgery for you. For that, we have to stop warfarin for 5 days before your surgery, and we will not keep you unprotected. We will give you something called heparin, which is injectable.
And why
Because
happening,
what? Why heparin? Good question. Warfarin have a long duration of action. Mean it take 5 days to the effect of the warfarin to be stopped. So we have to stop it 5 days before your surgery. But injectable one have a short duration of action, nearly 12 hours. So we can stop it at 12 hours before your surgery. So we will
okay?
keep you on the so we'll keep you protected by the injectable one for 5 days before your surgery. Then we will stop it 12 hours for your surgery. Yes.
When can I resume taking my warfarin then?
You will resume your warfarin pills once we are satisfied there is no bleeding. Uh, then you will start to take warfarin pills, and we will do some blood test to see the effect of the warfarin and it's regaining to your blood thinning effect in your blood. Then we will stop the injectable one after the warfarin reach the or regain its effect.
And is it necessary to stay in the hospital prior to operation?
Usually, you have not to be stay in the hospital. If you can take this injectable one in your home, if you cannot take this injectable one in your home, we can contact our social worker to provide a community nurse to give you every day till your day of your surgery. But if we fail, unfortunately, you have to stay in the hospital 5 days before your surgery.
Okay, I also take anti-anxiety medication. Do I have to stop that too?
Uh, no, you have not to stop your anxiety medication. You can take it at morning of the surgery by taking a sips of water with this pills or medication.
Okay. You said I can administer this.
Sorry, I
How
didn't hear you.
how am I going? Okay, so you said that it's not necessary for staying in hospital, so
Yeah,
I can have this medication at home.
yeah. If you can take it by yourself, or if you cannot, uh, we can provide if we can provide a community nurse to give you. But if we fail, Unfortunately, you have to stay in the hospital for 5 days.
Okay. Thank you.
Okay, let me explain and summarize to you what we have discussed already. You are planned to repair your hernia, and you are on warfarin pills, and we have to stop the warfarin pills 5 days before your date of the surgery, and you have to take the injectable one. Injectable one. Then we will resume the warfarin pills after the surgery once there is no bleeding and we are satisfied with your wound. After that, we will do some blood tests to ensure that warfarin regain its effect. And that's what we have discussed already. And I think this consent to sign it. Thank you. Do you have any
still have
question,
2
Okay.
Mr.
minutes.
John? Do you have any question?
No, thank you.
Okay, you still have 2 more minutes.
I don't know if there is any more question. Also, there is no difference between the, there is no difference between the heparin and warfarin, except the duration of the action. Warfarin have 5 days duration of action, but heparin have 12 hours of duration of action.
Doctor, is there any side effect of heparin?
No medication without side effect. But warfarin and heparin is the safe medication, and it's to protect you from the clotting around the artificial valve. The side effect could be bleeding. It could be some pain during injection of this injectable one or infection. But in general, warfarin and injectable one is necessary in your condition. Also, it is safe medication.
And 12 hours before the procedure, you have to stop.
You have to
taking
stop
the-
it. Yeah.
And this heparin should be given twice daily for 5 days.
Yeah.
And for this, first of all, patient has to be admitted. But patient will say patient does not want to be admitted. That's when you'll ask nursing staff to go and provide this facility to the patient at home. Thank you.